Hello everyone and welcome to another episode of Uncovering India. Today's episode is dedicated towards the senior citizens as we are observing International Day of Elderly Persons today. We all know how they are impacted by physical and mental health and the various vulnerabilities that are associated. And the impact of COVID-19 on the senior citizens have only reaffirmed how vulnerable they are to the various physical and mental health issues that are surrounding them. We have with us Dr. Divyamol Sasidharan, who is a geriatrician specialized with health issues of the senior citizens, and she will today throw some light on the issues that are affecting the senior citizens, especially in the backdrop of COVID-19. The ma'am has been working with the Sub-district hospital at Chicalim for last 2 years and has a long experience of serving the senior citizens. Hello ma'am, welcome to today's edition of Uncovering India. So what are your observations on issues that are affecting the senior citizens you would like to highlight on today's occasion?
I would like to mainly highlight the fact that elderly people are at higher risk, as we all know. And it is mainly because we do not take many of our symptoms seriously. Many of the elderly people tend to sit on their symptoms because they feel that it might be just part of old age. They are feeling weak, it might still be part of old age, whereas it may not be so. For example, as infection like corona can present with just weakness in elderly. It does not necessarily have to come with a fever, with chills, cough, flu, may not necessarily have to be there in an old person. So some people come with abdominal pain, some people come with even altered sensorium. They're just not feeling themselves and they're tested positive for COVID. So it's very important for them to take each and every signs that they're getting seriously and come for a checkup. There are also people who, because of this COVID, they have been sitting at home without medicines because they're scared to come to the hospital. But the thing is, their regular medicines have to be taken, meaning their comorbidities have to be kept under control. Then only they will be able to fight this better. Otherwise, their comorbidities will take over their health before the corona itself gets it over.
So what is the reason that they are not coming forward? Is it just only scare, or is it that they don't have the caregivers to bring them, or what is the situation?
Health is not a priority. I think health is not a priority for anybody as such, because you come to the hospital only when you really cannot do without it. Because otherwise for a regular checkup मतलब क्यों जाना है? As in टाइम नहीं है, बच्चों को देखना है, इधर देखना है, उधर टाइम लगता है, तो as in many people have other reasons why they don't go, and now on top of that there's corona also, so we should not go also. So I think probably that's why there are people who have not come for 4-5 months and now they're coming, and when you check their BPs are shooting up, their sugars are shot up, and then they'll be like, no, lockdown tha na, to sab band tha. So, and I keep telling them that no, hospital was open all the time, we were dispensing medicines, but they didn't come.
So what has been the impact, the toll taken on this senior citizens not coming for checkup during this lockdown period? Has it only complicated their health situation even further?
Yeah, because many people have uncontrolled diabetes now to an extent where many people are coming, you check the sugars are high. Yeah, and diabetes, as you know, it itself depresses the immunity of a person. So because of that also they become more vulnerable.
Now there are many mental health issues also they are also reporting with, which is gradually coming up.
A lot of mental issues, meaning because of people are not able to move around, children are somewhere, the elderly are left here. So there's a lot of anxiety associated with it. There's a lot of depression associated with it. And there's also a lot of people who are facing isolation, because now people are like scared to even go there because for a goodwill also, meaning because the youngsters are working, they do not want to infect their loved ones, so they do not tend to go there. But not seeing these loved ones also makes more depression and loneliness for the elderly. It's a big problem, but then the thing is there are so many limitations that has come up with COVID, And although there is technology like video calls and everything, our elderly are not familiar with it. So we have been preaching that they should get familiarized with it. We should take a step towards educating them, so that at least, because when an older person is, although you call, many people don't have time to call also, but calls matter. Even if it's a video call, when they see their loved one, at least it relieves a lot of stress, because just the voice, I can say I'm okay, but maybe I'm not okay.
When you get to see somebody up close.
Yeah, and especially parents and all, whether you're hiding or not, when you're saying I'm okay and your face doesn't look okay, they know that you're not okay. But so when they see you and you're saying you're okay, they get more convinced. So
what are the other issues that have got actually sidelined because of COVID that have been suffered by these senior citizens? Are the issues that have not come into highlight which should have come into picture?
actually, I think in a way I feel that God has been nice in a way that when COVID rose so much, maybe because people were at home or otherwise, the number of malaria, dengue and other infections have actually gone down. It has actually gone surprisingly down, because last year and all we were like, there was flooding with dengue, flooding with malaria. But this year so far, touch wood, but so far the counts are very low. I think people have been cleaning up their surroundings because they were available.
The sanitation part being very high in this time.
So because from the other point, I don't think government or anybody has had any time or the personnel to manage anything other than Corona this year. But I think people have been able to take a good turn and they had time for themselves this year. So I think such things have come down, so it's a good thing, meaning number of tests are going on, but still the number of positive dengues coming up are very less compared to last year, and so is malaria and all that. Other than that, the only problem that I feel is people are scared to report to hospital, mainly because of the quarantine, but they don't realize that it's because they're not reporting when they feel the symptom. They'll go give it to 10-20 people before they come and report and they become positive. And because already community transmission has also taken place, we are not at a point where you can trace all contacts, because you don't know who all you have been in contact with today, right? So the chances are that it will still spread.
So the analysis that you have given us, so how do you summarize this entire scenario, and what is your message for the community?
I feel that elderly populations can still go on with their normal life, normal routine with precautions. And when I say precautions, I mean practice the precautions religiously. Meaning wear a mask. When you're wearing a mask, it should actually... I feel that Corona has come and it's going to stay with us for a pretty long time. So we have to start acting smartly. So elderly people should be active. They have to also continue with their normal life. So meaning they can participate actively in their own indoor and outdoor activities, but with due precautions. And these precautions have to be taken seriously and not lightly. Like mask should be worn properly, that it should be covering both the nose and mouth of the person. It should not be pulled down all the time, pulled up all the time, because you're handling something that might be infected. And practice washing hands in between. And also they should be very careful that if in case like you happen to you're meeting somebody or anything, always encourage them also to wear masks so that they do not give you an infection. As much as possible, maintain at least a 1 meter distance between people, and in areas that are shared spaces, like let's say a sitting room and all that, keep the distance, and also make sure that there is good ventilation. Keep the windows, doors, etc. open, so it ensures that there's a good airflow. And avoid overcrowding and crowded places, crowded areas should be avoided. But as in health walks, like when you're walking alone, it has no issues, it does not affect you. And at the same time also, if you're walking with somebody with a distance, talking and walking, it is fine. Yeah, those are things that can still go on even today. And health should be prioritized, because only if the elderly are healthy can the youngsters go to work peacefully also. And the elderly have to also start prioritizing their own health before the others, because when they are healthy, everything is in order. If they fall sick, the whole pillar falls down. So they have to start taking care of themselves more, keep their comorbidities under control, come for regular checkups. Even if they are very scared to come to the hospital, things like BP, sugars can also be monitored at home, and using the BP monitor and a glucometer. And any difficulty they are having, they can send with a letter also, we are ready to help here. So meaning what they want, we can be able to be of help. So like that, I think they should get more active, care about themselves a bit more, so that they can help us in helping the society to build a happier and healthier Goa tomorrow.
Thank you, ma'am. As you just heard from our doctor, that carry on with your normal life. The senior citizens can carry on with your normal life, but with precautions. And please take care of your health, monitor your health parameters, and any discomfort of any kind, don't hesitate to come and get a checkup done, to get the necessary treatment done before the things aggravate and turns into a more serious condition, because the senior citizens are at higher risk to COVID and other health issues because of the various comorbidities that are attached with these health conditions. This is Shashwat Gupta Ray with Arya Rupate from Chicalim for Uncovering India. Thank you.